Dr. Jumper, you presented a talk today on Meet You at the Pars Plana. So would you sort of summarize what you presented?
Yeah, so the idea of this is what retina specialists and glaucoma specialists need to know about each other with regard to patient care. And there are a lot of diseases in which we work very closely with our glaucoma colleagues. And I'm a retina specialist that does that very frequently here in San Francisco. And so I was just sharing my thoughts on some of the conditions that we deal with and how they interact with with glaucoma and how we interact with our glaucoma colleagues.
Can you give us sort of examples of some of the things that the interaction that goes on between a retina specialist and a glaucoma specialist?
Yes, so currently we work together quite a bit in dealing with patients, especially those that are exposed to corticosteroid injection therapy inside the eye for retinal disease. We have to coordinate very carefully with our glaucoma colleagues because many of these patients need glaucoma therapy of some sort. And depending on the type of injection or treatment that we're using, it can be a very high rate of incisional surgery required, especially patients receiving a fluocinolone acetonide implant known as the Retisert implant.
So my last question is, how much would you recommend a retina specialist be involved in the clinical therapy for glaucoma patients?
Well, there are certain glaucoma diseases where the retina specialists are very involved. The one that I've talked about today has to do with using vitrectomy surgery to help in placing a pars plana tube shunt. And so we actually are in the operating room at the same time doing vitrectomy surgery and pars plana tube shunt placement by the glaucoma specialist in order to make the success of the glaucoma surgery greater. These are particularly needed in patients who have, for instance, corneal transplantation or problems with the anterior chamber where conventional tube shunt placement won't work.
Thank you, doctor. Appreciate your time.
You're welcome.